To return to automatic scrolling, double-click on the Select button. The frequency display shows the total breaths per minute based on the last 8 breaths and includes all breath types. The exhale tidal volume is measured at the patient connection and is updated at the end of each exhalation. The minute volume displays the exhale tidal volume for the last 60 seconds as calculated from the last 8 breaths. The I/E ratio displays the ratio between measured inspiratory time and measured expiratory time. The smaller of the inspiratory and expiratory times is normalized to 1. The calculated peak flow is based on the tidal volume and inspiratory time settings. Calculated peak flow is included in the list of monitored data when volume ventilation is selected, but is not included when pressure ventilation is selected. The peak inspiratory pressure displays the greatest pressure measured during the inspiratory phase. PIP is updated at the end of each inspiration. Mean airway pressure displays a running average of the airway pressure for the last 60 seconds and is updated every 10 seconds. The positive end expiratory pressure monitor displays the pressure in the airway circuit at the end of exhalation. PEEP is updated at the end of each exhalation. The airway pressure displays shows the real-time airway circuit pressure. If the spontaneous breathing trial, SBT mode, is activated on the LTV1150, 2 other monitored data will be displayed. Only a qualified clinician may perform this maneuver. The LTV generates an alarm when it detects a condition that requires immediate attention. Some alarms can reset themselves, for instance, a high-pressure alarm that is caused by a cough. Other alarms require some action from the operator, so the audio and visual alarms will continue until the problem is corrected. When an alarm occurs, an alarm message is flashed in the display window. An audible alarm is sounded. This means the alarm is active or is occurring now. When an alarm condition clears itself, or it is no longer in an active state, the audible alarm is silenced. For example, if the patient coughs once and sounds the high-pressure alarm, then on the next breath no alarm condition exists. The visual alarm message continues to flash in the display window, but there is no longer an audible alarm. As with any alarm active or cleared, the patient must be assessed and the alarm message cleared by pressing the Alarm Silence Reset button. Do not operate the ventilator without setting the adjustable alarms. All adjustable alarms must be set to ensure safe operation. Do not leave the patient unattended without checking to make sure all critical alarms, such as low-pressure alarms, have been set. Of course, all patients on life support ventilation should have a resuscitation bag on hand for emergency use. First, we will discuss all of the patient alarms. The apnea alarm occurs when the time since the start of the last breath exceeds the set apnea interval. When an apnea alarm occurs, the ventilator will enter the apnea backup mode of ventilation. The control displays used in the apnea backup mode are illuminated. All other control displays are dimmed. The audible alarm is also sounded. While in the apnea backup mode, the alarm continues to sound and the alarm message, breath rate are flashed in the display window. Apnea backup mode will continue until the caregiver resets the alarm or the patient triggers 2 consecutive breaths. Let's observe the LTV cycling into the apnea backup mode by using a test lung. As you can see and hear, since no breath was triggered, the ventilator went into the apnea backup mode. If the patient takes 2 consecutive breaths, the apnea backup rate stops and the LTV returns to the previous mode. Reset the apnea alarm and exit apnea backup ventilation by pressing the Silence Reset button twice. The high pressure alarm occurs when the circuit pressure exceeds the high pressure limit setting. When this alarm occurs, any inspiration in progress is terminated and the exhalation valve is opened. The high pressure message is flashed in the display window. The high pressure limit control display is flashed and the audible alarm sounds. To silence the high pressure alarm, press the Silence Reset button. Resolve the high pressure problem, then press the Silence Reset button to reset the alarm. One example of a high-pressure alarm would be the patient has secretions and needs to be suctioned. The low minute volume alarm occurs when the exhaled minute volume is less than the set minute volume. The low minute volume alarm message is flashed in the display window. The low minute volume control display is flashed and the audible alarm is sounded. To reset the low minute volume alarm, press the silence reset button twice. The low minute volume off message is displayed when the low minute volume alarm has been turned off by setting it to dashes. This is an informational message only. The low pressure alarm occurs when the peak inspiratory pressure is less than the low pressure setting. To reset the low pressure alarm, press the silence reset button twice. Now we'll take a look at the equipment alarms. The battery low alarm occurs when the ventilator is operating on internal battery power and the battery charge level drops below the low threshold. When a battery low alarm occurs, the battery level LED is yellow. The battery low message is displayed and the audible alarm is sounded. To reset the battery low alarm, press the silence reset button twice. When the battery reaches the low level, the ventilator will run for approximately 10 minutes on nominal settings. The actual run time may be more or less depending on ventilator settings, patient demand, and battery age. The battery empty alarm occurs when the ventilator is operating from internal battery power and the battery charge level drops below the empty threshold. For patient safety, this alarm can only be silenced once for 30 seconds and cannot be silenced preemptively. After the 30 seconds has elapsed, the alarm cannot be silenced again and will continue to sound and display until an alternate power source is provided or the battery is depleted and the ventilator in-op alarm will occur. When a battery empty alarm occurs, the battery level LED is red. The battery empty message is displayed and the audible alarm is sounded. When the battery reaches the empty level, the ventilator will run for approximately 5 minutes at nominal settings. To temporarily silence the battery empty alarm, press the silence reset button. The power low alarm occurs when the ventilator is operating on external battery power and the voltage drops to the low level. When a power low alarm occurs, the power low message is flashed in the display window. The external power LED is displayed yellow. The audible alarm is sounded. To reset the power low alarm, press the silence reset button twice. The power lost alarm occurs when the ventilator is operating on external power and switches to the internal battery. The change to internal battery is made when the external power voltage drops below the usable level. There is no interruption in ventilation. When a power lost alarm occurs, the power lost message is flashed in the display window. The external power and charge status LEDs are turned off. The battery level LED is lit, showing the internal battery charge level. The ventilator begins operating from the internal battery. The audible alarm is sounded. After 60 seconds, the displays are turned off to conserve battery power. To reset the power lost alarm, press the silence reset button twice. The high PEEP alarm occurs when the patient circuit positive end expiratory pressure, PEEP, exceeds the high PEEP alarm setting. The high PEEP message is flashed in the display window and the audible alarm is sounded. To reset the high PEEP alarm, push the silence reset button once to silence the audible alarm and twice to reset the alarm. The low PEEP alarm occurs when the patient circuit PEEP is less than the low PEEP alarm setting. When a low PEEP alarm occurs, the low PEEP message is flashed in the display window and the audible alarm is sounded. To reset the low PEEP alarm, push the silence reset button once to silence the audible alarm and twice to reset the alarm. The ventilator inoperative alarm occurs when the ventilator is switched from on to standby, or the ventilator detects any condition that is deemed to make the ventilator unsafe. When an in-op alarm occurs, the ventilator shuts down and sets the hardware to a safe state so the patient can breathe room air. Inspiratory flow is stopped and the exhalation valve is opened, allowing the patient to breathe spontaneously from room air. The oxygen blending solenoids are closed. The in-op LED is illuminated red. The audible alarm is sounded continuously. To silence the in-op alarm, press the silence reset button. An in-op alarm is also generated as part of the normal process of switching the ventilator off and does not indicate a problem at that time. The in-op LED will remain lit for approximately 5 minutes and does not affect battery life. The locked message is displayed when a button is pressed while the controls are locked. No audible alarm is given. When a locked message is displayed, the locked message is flashed in the display window for 5 seconds or until the controls are unlocked. To unlock the controls when Easy Unlock is selected, simply press and release the control lock button. To unlock the controls when Hard Unlock is selected, press and hold the control lock button for 3 seconds. The Remove Patient alarm occurs when the ventilator is powered up in the ventilator checkout or ventilator maintenance modes. This is to remind you to remove the patient from the ventilator before proceeding, since the ventilator does not deliver gas during these tests. To reset the Remove Patient alarm, press the alarm silence button twice. The following alarms occur infrequently: the defaults alarm, hardware faults alarm, no CAL data alarm and reset alarm, and the various SBT alarms. Please consult your operator's manual for more information. The LTV is designed to run on external AC power source, an external battery, an external DC power source, or its internal battery. When the ventilator is connected to an external power source, the ventilator's internal battery is continuously charged. The charge status LED is illuminated green when the internal battery is completely charged. If the charge status LED is red or flashing yellow for more than 1 hour or does not show a complete charge after 24 hours, the battery is defective and should be replaced. To run the ventilator from the Pulmonetics system's AC power adapter, connect the power connector from the AC adapter to the power port pigtail connector on the left side of the ventilator. Connect the proper AC power cable, either a 110 or 220 volt plug, into the AC power adapter. Connect the 110 or 220 volt power cable to a suitable power source. Verify that the external power LED shows green or amber. Several external battery options are available from Pulmonetics systems. Each battery system has its own requirements, so be sure to read those instructions carefully before using the external battery with the LTV. The cables for LTV-compatible external battery systems are pre-wired and properly terminated to ensure safe connection to the LTV series ventilators. To run the ventilator from an external battery, connect the power connector on the battery cable to the power port pigtail connector on the left side of the ventilator. To avoid damaging the ventilator or the power connector, push the release button on the connector before removing it from the ventilator power port pigtail connector. Verify that the external power LED shows green or amber. While the ventilator is connected to the external battery, the internal battery is being continuously charged. Please note, some external battery packs must be recharged only with Pulmonetics Systems' external battery charger. The external battery must be disconnected from the LTV to connect to an external battery charger. An optional automobile power adapter is available to power the LTV1150 ventilator while in a vehicle. This adapter is designed to connect to pre-wired positive 12-volt automobile cigarette lighter or auxiliary power outlets capable of supplying at least 20 amps of current. Please read the automobile power adapter instructions for use before using the LTV ventilator. The ventilator must not be powered by the automobile power adapter when starting or jump-starting the auto. This could seriously damage the ventilator. In some automobiles, the power outlet only operates when the vehicle is running. When operating on the automobile power adapter with the vehicle turned off, verify which power source the ventilator is using by checking the external power and battery level LEDs on the ventilator. If the external power status LED shows green or amber, the ventilator is operating from the automobile power adapter. If the external power LED is off and the battery level LED is lit, the ventilator is operating from its internal battery. After starting the vehicle, connect the automobile lighter adapter to the cigarette lighter or power outlet on the vehicle. Verify the LED on the adapter shows green. Connect the power connector of the adapter to the power port pigtail connector on the left side of the ventilator. Verify the external power LED shows green or amber and the charge status LED is lit. Please read all instruction and notes of caution before using any battery source or the automobile cigarette lighter adapter. Before cleaning the ventilator or patient circuit, wash your hands with soap and warm water. Always follow universal precautions. Clean all external surfaces of the ventilator prior to initial use and after each patient use and whenever necessary. To clean the ventilator, wipe the exterior surfaces with a clean, damp cloth with an appropriate bactericidal or germicidal agent. Follow the cleaning agent manufacturer's recommendations regarding contact time. Use caution. Do not sterilize the ventilator. Standard sterilization techniques may damage the ventilator. Do not use cleaning agents that contain phenols, ammonium chloride, chloride compounds, more than 2% glutaraldehyde, or abrasives. These agents may damage plastic components and the front panel overlay. Do not immerse the ventilator in liquid sterilizing agents or liquids of any kind. Do not spray cleaning solutions directly onto the front panel. Do not allow cleaning solutions to pool on the front panel. Check with the manufacturer of all cleaning agents and sterilizing equipment to ensure safe handling procedures are followed. If you are using a reusable patient circuit, please refer to the Cleaning, Disinfecting, and Sterilizing chapter in the LTV1150 manual. The inlet filter is located on the lower left-hand side of the LTV1150. Remove the inlet filter by gently pinching the foam filter and pulling it out. Hand wash the filter using warm water and a mild liquid detergent. Rinse with warm water. Inspect the filter and replace it with a new filter if necessary. Allow the filter to air dry before reinstalling it. Do not install a wet or damp filter into the ventilator. This could damage the ventilator. Very carefully, use a small screwdriver to remove the fan filter grill from its housing. Remove the fan filter by gently pinching it with your fingers, then pull it out. If you touch the fan blade while removing the fan filter grill or filter, a hardware fault will occur. This is normal. Clear the hardware fault alarm by using the silence reset button. Hand wash the filter using warm water and a mild liquid detergent. Rinse the filter thoroughly in warm water to remove all detergent. Inspect the filter for damage and replace if necessary. Allow the filter to air dry before reinstalling it. Reinstall the filter and snap the fan filter grill into place. Do not install a wet or damp filter into the ventilator. This could damage the ventilator. This concludes the LTV training video. Thank you for watching. If you need more information on the installation of a new ventilator, maintenance requirements, extensive troubleshooting, operating theory, or ventilator specifications, please see your operator's manual or contact your local Pulmonetics system sales representative.